Hi friends, I am Dr. Pratap Sinato. I have done MD in Pharmacy Medicine and today I will continue with Forensic Psychiatry. In this video, we will discuss about common symptom that is delirium and delusion. Coming to delirium, by definition, delirium is acute reversible mental disorder characterized by confusion, impairment of consciousness, disorientation mainly related to time, emotional lability, hallucination, illusion, impulsive, irrational, violent behavior. So in this condition, mainly it is acute condition where the person has some type of confusion, disorientation, impairment of consciousness, where he doesn't able to understand what is the situation where he is present. There is a disorientation mainly related to time. There is emotional lability where the person may have some hallucination or illusion. There may be impulsive, irrational, and violent behavior may also be seen. So this is a condition where the person is almost confused and disoriented. In early stages of delirium, the patient is restless, uneasy, and sleepless. Later on, he loses self-control, becomes excited, and talks furiously. So this is a delirium. And common cause of delirium includes drugs intoxication and also commonly seen alcohol intoxication. Sometimes and also whenever alcohol withdrawal also it is commonly seen. In case of some head injuries cases, delirium is seen. In case of certain physical diseases where it is associated with high fever, delirium is commonly seen. So any normal person who have some because of some disease, he has some high fever, the person may experience some form of delusion where the person may be confused or irritable state where he is unable to understand the situation where he is present. Also, this delirium may be seen also in cases of mental stress. Medical importance of delirium. Person in delirium may become impulsive and violent and may sometimes commit suicide to avoid delirium. Any act or offense committed by such a person is not responsible for his criminal acts. So, since the person is unable to understand what he is doing, so any offense when he commits during delirium stage is not considered as a is not responsible for those acts. Coming to next type of common symptom is a delusion. So, delusion by definition is a false belief. So, this word is very important. Delusion is a false belief in something which is not a fact and which persists even after its falsity has been clearly demonstrated. The person in case of delusion, when the person is experiencing delusion, he believes in something, means any situation, any something he believes in, he has some belief that persists, which is not a fact, but it is persist even when its falsity is been demonstrated. That is considered as a delusion. Normal person may also experience delusion, but is capable of correcting by his reasoning power or by his past experience or by when the person is being convinced by others. So any normal person may have also experienced some form of delusion, but he can overcome it by based on his own reasoning power or by some past experience which he has experienced. So he may overcome that, or when a person other person convince him, so he can overcome that. But in case of the person is mentally ill, the delusion persists and it may become serious enough to be cause a threat to him or others. A secondary delusion, where the delusion is because of some morbid experience, it may also be present where the person because of past life experience, because of some stressful experience or childhood trauma, he may develop certain delusion which is considered as a secondary delusion. Delusion in mentally ill is a symptom of brain disease. So any person who has mentally ill person who has a delusion is mainly because of some brain disease. It is mainly seen in case of epilepsy, affective and schizophrenia, psychosis. Commonly, delusion is seen. Now coming to types of delusion. So various form of delusion is present. So mainly the types includes means what is the belief. So types of delusion mainly includes the belief in which the person believe in what in a situation or something which is a false belief. So first is delusion of grandeur or exaltation. So here the man imagines himself to be very rich while reality is very poor or pauper. Usually seen in case of mania and maybe associated with delusion of other persecution. So here the person delusion of grandeur, the person is thinks he is very rich, though he may not doesn't have any money or doesn't money to spend. So he may spend money, some money, he may take loan, considering that he is very rich, that he may do those acts, even though he is very poor. Opposite to that is delusion of poverty. The person thinks he or she is poor or pauper, though he is or she is very rich. Though the person has all the money, but even he considers himself to be very poor and lives in a very poor condition. Next type of delusion is delusion of persecution. So it's also paranoid delusion, where the person imagines that attempts are being made to poison him by his nearest relatives, like wife, sons, or parents. So here the person has continuous belief that someone is trying to kill him, mainly the close relatives. So may tried attempts are being made to poison him or kill him. They are seen in cases of paranoid schizophrenia, dementia, and depression cases. Delusion of grandeur and persecutions are often present together. So when the person has delusion of grandeur that he thinks very rich, he feels that his family members or relatives will try to kill him so that they can get his property. So it is associated with delusion of grandeur as well as delusion of persecution may be associated with each other. He may even commit suicide or kill his own family members, claiming to be that they may try to kill him, or he may kill some innocent person thinking that him to be his enemy also. So based on situation, he may kill himself or kill others, his family members or any one person. Next type of delusion, delusion of reference. Here the person believes that people, things, or events, etc., refer to him in a special way. So here, wherever he walks or goes, he believes that certain people, things, or events are happening and referring him. He believes that even the strangers in the street are looking at him and are talking about him, or at times in the radio or newspaper are referring to him. He may listen some radio and he may hear some his name or talked about that, and he feels that they are talking about his life or his activity, whatever he has done, or he may read some news articles and he believe that whatever they are written is about his life itself. That is delusion of reference. Next type of delusion is delusion of influence. Here the person complains that his thoughts, feelings, and actions are being influenced and controlled by some outside agency like radio, hypnotism, telepathy, etc. So here the person believes that someone is influencing him to do certain acts, or whatever he has done is because of someone influenced because of that. So it may be controlled by some agency like radio, or he may be hypnotized. He feels that he may be hypnotized, or someone is influencing him to do certain things. So whatever he has, he may done some acts. He may have in the work or in his studies, whatever he have made done, he believes that that is done because of someone's influence. On the basis of this imaginary command, he may also commit some unlawful act also. He believing that if he done some unlawful act, he may believe that that is influenced by other person. This is mainly seen in case of schizophrenic conditions. Next type of delusion is delusion of inferiority. It is also known as Othello syndrome. Here the man believes and imagines that his wife to be unlawful, while the fact is that she is chaste or she is faithful. So here the person constantly believes that the wife is having some kind of affair or some kind of boyfriend or like that. Then next type is delusion of self reapproach. Here the person blames himself for the past failures and misdeeds which are often of no importance. In serious cases, the person may punish himself by committing suicide also. Here the person blames himself for any past misdeeds. So he may have some committed some minor thing, or he may have not done any failures. There may be some, like he may have failed in one subject in the past in certain class, and he may believe that because of that failure he is failure in throughout his life, and which is not of any importance. Even though it is not important, he believes that that failure is still present and it is influencing him, and in serious cases that may lead to committing suicide also. Next type of delusion is delusion of nihilistic. Here the patient does not believe in his existence or the existence of earthly matters or that there is any world. So it is commonly seen in depression where the person doesn't believe in himself that he is present in the world or world exists, or he just believes that he is just a speck, world doesn't exist or any other thing matters. So this is commonly seen in case of depressive individuals. Next type of delusion is delusion of hypochondriac, where there is a persistent concern with the fear or belief of having one or more serious diseases based on patient's own unrealistic interpretation of physical signs and symptoms. So here the person may have some signs or some symptoms which he misinterprets and believes that there is some abnormality in his body or some serious disease, like believing that he has cancer. Even there is a mild headache is present, he may believe that there is a brain trauma is present. There may be some stomach pain, he may believe that there is some ulcer, and he may start believing that, and severe form of that he may visit from one doctor to another. And though he is normal, he just believes that there is some abnormality in his body and he has some serious disease. That is delusion of hypochondriac. Some other forms of delusion which is not significant, like delusion of doubles, where the patient believes that another person has physically transformed into themselves, that he believes that one person has transformed into that himself. Or delusion of jealousy, where the person is constantly admires or feels threatened by other person's achievements or other person's relatives, wives, those things. He feels jealousy in a form of belief that though that is not related to him, but he constantly gets fear from other person's achievements. Then delusion of religion. It is again controversial, where the person believes in a god, though it is not. It is proved or it can it's shown that it is not God may not be present. Even then, even then, there are religious groups where they believe is present, though it's not considered as a delusion. It's form of a delusion which can be accepted as a delusion. Coming to medical importance of delusion, delusion is not never an isolated disorder. It may be an indication of some deep-seated, widespread disorder. For that reason, such person cannot be regarded as fully responsible for his antisocial acts. So any person who commits any antisocial acts based on delusion, he is not responsible for his acts. Suicide is major risk factor in delusion. There may be a combination of murder or suicide or other crimes may be committed during the because of delusion. These are my references. Thank you.